Dr. Paul here. I've got a rash in a young lady that you're gonna have to see to believe. Hello. Gloves. So
she actually has it around her eyes, which I've never seen.
Yep.
And a slight amount on her ears.
So there's a little tiny bit of redness at the back of her throat, but not bad in the mouth. And of course we can see we've got little red dots around the eyes. I've already looked previously and the conjunctiva are fine. She doesn't have any eye discharge. We've got little spots there.
Yeah.
Crusting starting to develop around the nose
there you go.
and around her mouth. And then we've got a few here. Now we can take any one of these red spots and push on it. And it goes away and then returns. So we push on it, it goes away. The reason I'm doing this for the viewers is petechiae, which might be little broken blood vessels, would not disappear when I push on them. That disappears and then reappears. That's a good thing. Let's move down to her legs, and you see we've got a lot of bigger stuff. They're red for the most part. When I push, it kind of blanches away and then returns. See how it comes back, blanches. You're doing so good. But then if we move down to the feet, and we'll start to see purplish looking stuff. But again, it's still for the most part blanches. So I can put pressure on it and it goes away and then reappears. And then looking at the bottom of the feet, we can see they're completely involved with this rash. And again, if I push on it, for the most part it blanches away. I recall when I was in training, walking in and seeing a rash that looked like this, and it only involved the legs. A little bit onto the buttocks, and that was it. And that was something called HSP, Enoch-Schonlein purpura, because this is sort of a little bit purpuric, but it isn't exactly because it blanches. So that's the big distinguishing feature. If you're a doctor in training and you walk in and you see a kid like this and they look really sick, that's not a child that's going home. You're gonna make sure they don't have a serious infection, right? And I can only say that in front of this mom because she's experienced. I wouldn't say that. You'd be like, I happen to know this is not a serious infection. First of all, you're still smiling. And that's a good thing, despite how miserable you're feeling. That's a good sign. And the fact that this blanches, she's relatively well appearing. This is not purpura, sepsis, HSP. It's not one of those serious blood infections. In other words, we are going to do a CBC before you go home just to play it safe, just to be absolutely certain that that looks fine. You can have conditions where you're low platelets and you're going to bleed into your own tissue, and that is something we want to make sure is not happening. I happen to think what's going on, if you happen to look at these lesions here, these two, 1, 2, they're raised with some crusting. If you slide up here, here's another one. It's sort of broken, raised with crusting. We've got something going on with this finger where it kind of looks like it tore and is crusted. Look at those hands.
Go back to the finger for me, light a little further back. Okay.
If you look at these hands, now a bad case of hand, foot, and mouth, you often will just see this and what we saw at the bottom of her feet. And again, look, for the most part, I can push and most of that redness momentarily goes away and then pops back up. Folks, this is the most impressive hand, foot, and mouth case I've ever seen. And if you look at some of these yellow crusters here, I think what we have now is what we would call impetigo, where the breaks in the skin have caused Staphylococcus, the most common organism to infect open wounds, and then that can actually spread through the body. So I think we have a case of hand, foot, and mouth Coxsackie virus, which has probably become super infected with Staphylococcus. So we're going to treat the staph. In Oregon, most of our staph is resistant to cephalexin and sensitive to trimethoprim sulfa. I have only had one case that was resistant to trimethoprim sulfa in Oregon in the last several years, and we've treated hundreds of these. I'm not showing you the diaper area for her privacy, but that was the worst. We had confluent red rash with now some crusting, and you could imagine some of these bigger type lesions like this one here spreading out from the genital area. And that makes me think of also perhaps a staph infection. For those of you who've seen a really bad yeast diaper dermatitis, it actually almost looked like that as well, but clearly what's going on with the hands and feet is not a yeast thing at all. This is Coxsackie virus until proven otherwise. And thank you for sharing. You are so sweet. You want to say hi? Oh, that's so sweet. Thank you so much. So anyway, there you have it. The best case of Coxsackie virus hand, foot, and mouth I've ever seen in 30 years of pediatrics. Thank you for sharing. Isn't that great? Don't you love to be known as the best case?
Twice.
Twice. Can you believe this? There's a puppy. Come look, come look. Isn't that about the cutest puppy you've ever seen?
That baby says, I'm scared.
Oh my goodness.
He's shivering.
That is a really,
Who's she?
that is a really cute puppy.
Gentle, good girl. Thank you.
That is great. Wow.
Her name's
Wow.
Haley.
That's Haley.
Tired.
Haley the puppy. Yeah. Okay. We won't always have a puppy here for you. Hey, it's Dr. Paul. Thanks for watching. I just want to remind you I've got this book coming out, The Vaccine Friendly Plan. Check out the information in the description. I hope you'll get this book. It can change the future for your children. Thanks for watching.